So I had a practice which was across the road from where we currently are. I had been planning to move it out of that building because we were running out of space, as it was part of my residential home. Particularly during COVID, we noticed that there was just not enough space for stuff. So I looked at a number of locations in the area. I spoke to the Dulwich estate, which is our landlord. This building was too expensive when I looked at it the first time, so I rejected it out of hand because of the state it was in. To cut a long story short, basically it was across the road from our original practice, so patients knew where they were coming, and eventually we managed to get the terms of the lease in a state that we could deal with. I've done a few restoration projects on various other buildings, and I know more or less what I want or how I imagine it to look. We had a really good architect here, so he did the layout for us. But yeah, well, the combination of the architect and me, but I knew it was the right place. It's just how we got there that was the fun part. It was obviously desirable from our point of view because that's part of the charm of the building, but it wasn't that we wanted to do it, we had to do it. It's grade 2 listed, so we are unbelievably restricted as to what we can do. Particularly in the old parts, the parts of the building that have architectural merit. This bit at the back that we're sitting in now is newer, so it was a juggling act. My aim always was that the communal areas, the waiting room area, should not be clinical. And I wanted the contrast between the reception and waiting room area and the surgeries to be as noticeable as possible. So I wanted people to see a big contrast between where they were sitting and when they were going into the clinical areas. And that I think we have achieved. The beauty of Eclipse, your company, is that you do everything. So for me, that was the major factor that brought you in. And that was helpful because you've got experience in the past and you know what you're looking at and you know how things work and you know which sequencing to do. That obviously made a huge difference to me. It was a headache last time, I remember, trying to get the different trades in and trying to slot them in at the right place and all that sort of thing. It's a nightmare. So I was quite happy. All that sort of organisational stuff is the stuff that gives you a headache when you're doing the project. So if somebody else takes that away, that's nice. The combination of getting the building works completed and fixing up the building works into the design of the surgeries was quite fun. I'm pretty good at not getting involved when I don't have to, because partly because I'm lazy and partly because I assume everybody knows what they're doing. Yeah, I mean that aspect, the fact that you could take that away was good. Very nice. So you always expect teething issues, always. There's no such thing as a smooth start to a new surgery. It's always a headache. How your supplier responds to you is massively important. And Eclipse, you've got very nice engineers, very charming chaps that come and work for you, and it's always good. And your response time is very quick. And when I see Charlie using it, you know, the way he flicks the images round and then, you know, expands and then sticks something in there and puts his implant in and, you know, changes the angle and stuff, I think, oh, I'm never going to be able to do that. I appreciate, but I like to be able to at least know what I'm looking at. I love the diagnostic tool. I mean, it's great. It's so much better. The diagnostics are so much better. And Vatech have been very helpful with that. The guys are really keen to train us, and he's been back a number of times. He's really good. Successful and appreciated, I think. People do appreciate the fact that you've made a bit of an effort to keep your standards up. And space. It's just nice having so much more space. They love it. I mean, it's a beautiful building. The equipment all looks great. We've had a lot of compliments on my chair colour choice, and lots of people have bounced up and down on those cushions and said, "Oh, this is nice." And of course, we get the benefit of the similar chair. So yeah, I think the patients appreciate having a new surgery because it looks nice and clean and it's tidy, and we're lucky to have a beautiful building. And yeah, and I think the equipment, the surgeries are looking good. Advice to anyone else, I would say if you think you're doing the right thing and you're convinced that it's the right thing, go for it. I think, you know, the thing is I thought it was the right thing for my list of patients, so that's why I did it. I would, yes.
And good.